But if you are with a patient who can communicate, whilst you are communicating with the patient, you are jotting down your problems, which is very vital. So, for instance, on a medical ward, some of the common problems you can have is pain. The patient can complain of pain. So, you find out the location of the pain. So, you don't just write patient complaints of pain, full stop. No. You should be able to state the location of the pain. So, patient complains of abdominal pain. Patient complains of chest pain. You should be able to tell the location of the pain. Oh, OCUTIPA, that's headache. So, patient complains of headache. And so, whilst you are fishing out your problems, you should be writing the problem that nobody will ask question about it. For instance, if I can write number 1, patient complains of pain, full stop. An examiner can be like, what do you mean by that? Where is the pain? So they put a question mark, where? But if you write patient complains of pain at the left leg, you are objective. You have told where the location of the pain is. And so nobody can penalize that. So pain is a problem that can exist both on the medical ward and the surgical ward, depending on the diagnosis of the patient. And so once you fish out a pain problem, you should know how to write. Don't just go and write patient complains of pain. No. You should tell the location of the pain. So maybe patient complains of headache, patient complains of chest pain, patient complains of abdominal pain. State the location of that pain. Okay. Then you move on to your section. So once you have fished out the problem, so for instance, I have located difficulty in breathing on the patient. I have located, so let's quickly go. We have maybe difficulty in breathing 1. Patient has difficulty in breathing. Maybe there is pain problem. And then maybe the patient cannot sleep. And the last one is maybe patient has a little knowledge on condition. Then you put the condition into bracket. Now, once you have fished out your problems, there's something you call prioritization. You prioritize it. So in a brief chat, what the patient has talked to you, he's giving you more problems, like 5. So quickly, as a nurse, that is why you are a nurse, use your clinical judgment. This problem that the patient has brought out, which one should I attend to first? That brings you to triage your problem. So prioritize your problem. So you have difficulty in breathing. We've mentioned pain. We have mentioned difficulty in sleeping. You have mentioned deficient knowledge. These are our 4 problems. Now, how we prioritize it? You will see that the most urgent I should attend to is the breathing problem. So I can just go straight away. Patient complains of difficulty in breathing. On a medical ward, it can happen. But what if the patient is unconscious and is on oxygen? You cannot go and write patient complains of difficulty in breathing. Patient that is not talking is unconscious, and you are telling us on paper that patient complains. Is it spiritual nursing that you are practicing? So if an unconscious patient is on oxygen, straight away, patient has difficulty in breathing for an unconscious patient. But if it's a patient like myself who is able to talk and we are talking, I tell her, oh, because of my difficulty in breathing, I am having oxygen on. So I am able to verbalize. So patient complains of difficulty in breathing, or patient has difficulty in breathing. Simple. So I'll choose respiration first from that 4 problems we discussed. So one of the problems, the patient has difficulty in breathing. If you go to examination and it says start work, and you can see oxygen on the patient, quickly it should give you a sign that there is a breathing problem. So you cannot bypass that. Then you come again between pain, sleeping difficulty, and then knowledge. I'll go on with pain as my second problem. So my first problem, patient complains of difficulty in breathing. Second, patient is in pain, maybe into brackets headache. Now you don't want to use monotony words, so you wrote the first one, patient complains of difficulty in breathing. Then you come again, patient complains of headache. You see, complains of, there are more words you can use. You don't want your word to be one way. So I can write patient has difficulty in breathing. Then I come to patient complains of headache. Patient complains of abdominal pain, what type of the pain it is, patient complain of it. So you see that I have not used one word throughout. I have varied my vocabulary. This makes your work very lively. It is not wrong, by the way, but then it makes your work what? Lively. So patient complains of difficulty in breathing, or patient has difficulty in breathing. Patient complains of headache. So we are using headache for instance. So patient complains of headache. So you see that in prioritizing my problems, I have brought breathing difficulty first, and I have now brought what? The pain. So I'm left with what? The sleeping and the knowledge deficit. So between these two, which one again do you think I should attend to first? I'll go for the sleeping problem, because the patient told you that what? He was not able to sleep, and that led to headache. So the next problem is what? Patient is not able to sleep well at night. Now, with the sleeping problem, most candidates just going to write patient complains of difficulty in sleeping, or patient cannot sleep. You should tell, is it during the day, is it during the night? You should be specific. So the patient, oh, mean down, pacho, anajo anase, you should specify. So, oh, you be like, oh, anajo ana the day. So you go, patient has difficulty in sleeping at night, or patient cannot sleep well during the day. You should specify the time limit that the patient cannot. Is it during the day, during the night? You should tell. Okay, then the last point that we are triaging now is what? The knowledge. Now, you should not go and write patient has no knowledge on condition. No. There is no way a patient will not even have a knowledge on condition. No. He came for admission. And so definitely the doctors would have told her that, oh, when you're malaria. They giving that information alone, though the patient doesn't have much knowledge on that, at least he's been told he has malaria. So you shouldn't go and be like patient has no knowledge on condition. No. You can go patient has little insight about malaria, or about his condition into bracket malaria. Always put the condition into bracket. Don't just write it blur like that. So patient has inadequate knowledge on his illness into bracket malaria. Always state the illness in bracket. Okay, that will help you get more marks. Okay, so we don't just write patient has no knowledge on condition. No, at least he has a knowledge, but it is not sufficient. So patient has insufficient information about his condition, or patient has little insight about his condition, put it into bracket, or patient whatever about. So this is how you write your problems. You should have at the back of your mind that when you are writing your care plan, you may not be there to defend what you've written. So write your statement in form of it in such a way that nobody will question what you are doing. Okay, so these are some ways that you can write your problems. Okay, these are some of the ways you can write your problems. And so I believe the interaction is getting very interesting. You can share to your friends who are in the final years across the country to join us as you are moving on. Good. So we have put our problems down. Now, the way you have written your problem should correspond with your strengths. So, for instance, if I've written patient 1, patient has difficulty, and those who have the care plan or those who have their notes can also be writing some of the things you are saying down for quick reference. Has difficulty in breathing. Pardon me if you can't see my handwriting. And then maybe the second problem is patient complains of chest pain, or whatever pain it is. Now, when you come to the strength column, that you can see on the paper, one rule is that your problem number 1 should be your strength number 1. So our problem number 1, which is patient has difficulty in breathing, it should be the corresponding strength for it. So the problem number 1 should match the strength number 1. Problem number 2, strength number 2. Number 3, number 3, number 4, number 4. You don't mix it up. If you do that, you lose your mark. You won't get a 2 full marks. You may get 2 marks here, but when it comes to the strength, they will mark you 0. So please let's take note about it, our able candidates. When you go into your exam and it says start work, when you put your first problem down or you fit all your 4 problems, you prioritize them. When I jump to the strength should correspond in that manner. It should correspond in that manner. I don't want to see problem number 2 strength beginning the number 1. No, it's wrong. So patient has difficulty in breathing. Its corresponding strength should be number 1 for the strength column. I believe that is well explained. Good. Now, one may ask, or some students find it difficult in writing a patient strength. Now, put this at the back of your mind. A strength is what the patient has or he or she can do to help solve the situation. Take note. A strength is what the patient has or can do to help solve the situation. So I have a problem. What I have or what I can do to solve my problem is my strength. So have it at the back of your mind. A strength can be defined as what a patient has or can do to help solve his or her problem. So for instance, I said I have difficulty in breathing. You ask yourself, what can I do to help solve this problem? That will become your strength. So as a candidate in the exam, patient has difficulty in breathing or patient complains of difficulty in breathing. Is the patient on oxygen? Yes, so that's a strength. So patient is on oxygen therapy becomes a strength. So what is the patient having or what can the patient do? It's the strength you are looking at. So I have difficulty in breathing. So if the patient is able to verbalize to you, it's a strength. If the patient is on oxygen, it's a strength. So patient has difficulty in breathing. A strength can be what? Patient is on oxygen therapy. A strength can be what? Patient can verbalize he has difficulty in breathing. It's a strength. So we say what I have or what I can do is my strength. So once I put down patient has difficulty in breathing, it should be my corresponding number 1 strength. So if you go to examination, or quickly think, if you are working with time, you fix out your problems. With this problem, what is the patient having? Or what can the patient do to help solve the problem? Now, you'll be marked down if you go and say an unconscious patient, right? Then you go and be like, you say patient has difficulty in breathing, which is correct. Then you come, patient can verbalize he feels or he has difficulty in breathing. You yourself ask yourself, somebody obi or down unconscious on kasa. Now patient can verbalize he or she is having difficulty in breathing. You yourself, if you are examiner, will you mark that correct? Obviously no. And so you see that quickly you should know that you are wrong. So an unconscious patient will always be what the patient has. So the difficulty in breathing, he's on oxygen, that is a strength. Patient is on oxygen therapy where the patient is unconscious. For instance, there's a wound on the unconscious patient's left leg. So you write patient has wound on the left leg. Don't just write patient has wound. No, you should tell the location of the wound. So for problems like pain, wound, we should tell the location. So patient has wound on the left leg. You have written that as your problem, and per assessment you saw a wound, correct? The patient is unconscious. What do you think will be a strength for that patient? A strength can be what? Patient has sterile items for wound dressing. That is a patient who is what? An unconscious patient, a patient who cannot talk by himself. Is it clear? Patient has what? Sterile items for wound dressing can be a strength. Or patient family members can afford items for wound dressing. They are all strength. Don't be fixated. Open your mind. Look around the patient. What is the patient having to solve his problem? Despite me being unconscious, I still have a strength. So I am unconscious. I have wound on my left leg. You check my things. You do your assessment. He has sterile gauze. He has povidone. We are taught to work. It is a strength. So quickly, patient has sterile items for wound dressing.